So we get asked a lot at EBM Plus why we bother, why we're doing this work at all. And we keep giving people answers, and quite often different answers. You know, maybe that's not so much of a surprise. I mean, we're doing a project that covers a lot of ground. It's got some new philosophical stuff in it. It's got some novel approaches to medical issues in it. We touch on social care and epidemiology and all sorts of other things. But just because of that lingering worry that we might be giving everyone, we might be telling everyone what they want to hear, I've started gathering together some of the sort of pro-EBM Plus arguments that we make. And today's is a good and simple one, and it's the idea that statistics in medicine aren't a magic bullet. They don't tell you everything that you might want to know. Okay, when it's said bluntly like that, it sounds very straightforward, but it's something that has a kind of an influence on lots of different practices. So just imagine that you've got the results of like the best ever drug trial that's done, and you happen to be unlucky enough to have the disease that drug was a treatment for. Obviously, for each individual, that answer depends. You might not want to take the drug. You might not want to take a drug at all. You might be allergic to that particular drug, or it might be deeply inconvenient for your line of work, or it might have side effects, and so on and so on and so on. We're all different as individuals, and we all want different things from our healthcare. But it turns out that groups, the kind of thing that guidelines cover, are made up of individuals. Those preferences go through into groups, and we know that actual decisions that policymakers have to take about drugs and whether we should use them tend to involve some consideration of those kind of pragmatic factors. It's not just that the statistical trial result tells you everything that you should do. Should we have this drug in this country or not? In the EBM Plus project, one of the things that we're trying to do is make sense of some of the other factors that contribute to those kinds of decisions in medical practice.